thanks everyone for asking me to come here and speak today about something that's, one of a real passion of mine. I've worked at this trust for 31 years and I've worked in cardiology and surgery. I've had various different positions and I've always loved cardiac rehab and I've been looking after cardiac rehab here for the last 8 years. And what you just heard there is a really big concern as well. Cardiac rehab has been going a long time. And initially, it was for patients who'd had a heart attack. So a lot of focus was on those patients. And then came along some other conditions where we put a stent in. So those patients started to come along to cardiac rehab. And then we noticed patients were having bypasses and valves. And it was, well, the commissioners, so the people who actually pay for cardiac rehab where you live, said, yeah, well, let's get those patients in as well. And more recently, we've been taking more patients with heart failure, because that's another group of patients that would really benefit. And if you think about what we do at cardiac rehab, everybody that's had any type of surgery would benefit from cardiac rehab when I show you what the elements are, or people who've been to cardiac rehab. But as you rightly say, there's a lot of places that will call me and say, but I can't take this patient, I'm not commissioned, we don't have enough staff, we don't understand what we should do with those patients. So we're focused very much on patients who've had a heart attack, but we're a little bit frightened of patients who've perhaps got a dissection and have had surgery, or patients who've had aneurysms. So it does cause quite a bit of there's a mixed bag of cardiac rehab going on across the country. That's kind of what you are when you come to us, when you come to cardiac rehab. That's how we kind of think. Your heart's in a couple of little pieces there, so it's not quite right. It's a little bit broken and you feel a bit like that, very frightened about what's next. And we've just heard there about the fantastic opportunities for people to be experts and to do the surgery. And then we don't want to send you home and then just say, right, that's it. We think of cardiac rehab really as just as important treatment as if you've having the surgery as well, because this is the next step. So what's the benefits of cardiac rehab? Well, that's the science, really, because it reduces all-cause mortality by 11 to 26%. No medication can do that. So that's one of the massive big claims of cardiac rehab. Cardiac mortality, so they're by 36%. Again, no medications it's been proven. Statins and lipid lowering and other medications can't give the same outcomes as that. Generally, the morbidity, so it's your survival. Unplanned admissions. Now you might think, well, does that really matter for me? But yeah, once you're out of hospital, we want to keep you out. We don't want you to keep going back in with complications and having to go back in, because every time you go back into hospital, you're more at risk of developing something else. It improves your quality of life. So what does that mean? That's different for different people. Some people will be quite happy to just go back to doing something small. Some people want to get back, some people work, some people want to go right back and do everything that they did before. Not always possible with the type of surgery that you may have had, but the aim is to get you functionally back to your functional capacity, the best that you can be. And that's what rehab does. It supports early return to work. Lots of people younger having this condition, people want to go back to work. People don't want to just say, I've had a heart operation and that's me done. I just sit at home and do nothing and waste away. That's not what we want. It gives you the skills as well to manage your condition. Just seen the slide before there, you probably have to be on medication. There'll be some restrictions. So you need some support to be able to manage those things, because it's a lifelong thing that's going to happen to you afterwards as well. It's not something that is going to go away. So if you're here with us, then you will be referred to your local programme. And we do that by an electronic referral. All your details will be on that, full medical history, so that your cardiac rehab nurse then can open that and see exactly what they're going to do. So what actually is it? That was the sciencey bit, but what actually is it? So it's around about an 8 to 10 week programme, and that's a minimum of individualised programme. So it offers psychological support. What does that mean? That can be lots of different things. It could be the occupational therapist. It can be just a chance to sit and talk. A lot of people think, cardiac rehab, is that just where you go to have a bit of a natter and a bit of sit round and talk? Well, yeah, it is. But obviously it's got a key element of what it's doing. But actually it is an opportunity to be with like-minded people who've had the same operation as you or similar, who were all frightened. You probably won't see as many people there with the same condition. You'll probably see lots of people there who've had valves and bypass and they've had stents put in. But those people are frightened as well, so that's a key element about what do you do? What's safe? What can I do that's safe? Should I do not enough or should I do too much? And that's what it helps with. It's a big, massive change. It's a massive operation, especially if you're coming in as emergency. it's very frightening. And that's what we hope that at rehab we can do, is allay those fears and give you those coping mechanisms to look after yourself. Physical activity, well, that's the stumbling block, isn't it? Because what do you do? Too much, too little? You just don't really know. We don't want you to do nothing, and we don't want you to obviously do more than you should. So obviously it's all supervised. So depending on what is on your referral, the nurse will have that ability to know how they'll manage your physical activity under supervision with the physios. Healthy lifestyle education and support. It's just as important to carry on looking after your heart, because you think, oh, this was my aorta that's got a tear and it's dissected, but my heart's fine, but we don't know that. Vascular, we know eating healthy, not smoking, moderate alcohol, all of those things help keep our brain healthy as well. They keep our kidneys healthy. They stop us getting, or can go a long way to stop us getting vascular dementia. So it's really important that we do look after those other things, even if we think, well, we haven't got any blocked arteries as well. It's all about keeping it's cardiovascular health. So it's really important. Blood pressure, we just touched upon that before. It's really important that we keep that blood pressure low. We don't want that blood pressure going high as well. So obviously to manage all that. So how could we do that with your blood pressure? Well, obviously physical activity will help with that, but also we can help manage your medications as well. I know that a lot of patients who go to cardiac rehab, one of the things we know is that they do stay on the medications. That's something that patients are not very good at probably about 3 or 4 months down the line. Suddenly they start forgetting to take them and they'll just pick and choose, or and it's vital that you do take your medications, you take them on time. We're only human. And that's what that helps to do. But the nurses in the cardiac rehab can actually titrate, so they can actually change your doses of your medication. So there's not the necessity to always have to pop to see your GP. It's not as easy to go and just get an appointment. Everything can be done there for you. So it's a one-stop shop. It's not in every cardiac rehab, but most cardiac rehabs now have got nurses who are non-medical prescribers who can do that. And goal setting. So it's important. No two people will be the same that come to cardiac rehab. No two people have had exactly the same operation or want the same things. So that's why it's an individualised programme, so that you can set those goals. What do you want to achieve? It might be that you just want to do X, Y and Z. Somebody else might want to do the whole raft. And that's why it's an individualised programme, and that you get from it what you need from it as well. The cardiac rehab is usually in your community setting, and occasionally it might be in your hospital, but more and more now are in the community setting. And that's what we want you to sort of be, a bit before when we said it's a little bit broken and it just needs kind of putting together. It's not the miracle cure. It's not, we can't just suddenly go, right, you're fixed and everything's fine. But that's what we hope at the end, is that you've got all that knowledge and that your heart is fight fit and that you can go on. These are the things I sent to, just in response to the service when I was referring patients out. I was getting lots of calls from lots of the staff saying, I can't take this patient. I'm too frightened. I don't know if they're still waiting for surgery, or they've had surgery, if they had the full lot, are they coming back and having any more? How stable are they? What's their blood pressure need to be? So rather than perhaps do a little bit of learning, a lot of the cardiac rehabs just said, well, we just can't invite these patients. We can't. We just haven't got anywhere for these patients to go. So they've been turning patients down quite a lot. So we put this together. A colleague of mine who used to be the aortic nerve specialist here, we put this together. And we've given this to all of the cardiac rehab in Cheshire and Merseyside. Now I'm the chair of the Cheshire and Merseyside Rehab Practitioners Forum, so we actually went out and did some education with all of those teams. We gave them some parameters, we gave them some blood pressure measurements, and we gave them this. And obviously this is just a table. You've got to take everybody on their own face value and a full assessment, but it gave them a much better idea, so they're not turning patients away like they once were. Obviously, I think the thing to pick out there is if you're still waiting for any surgery. If you've had the full surgery, then you can go on and you've got full rehab. You can do maybe if you've got any residual dissection or anything like that, we do say that there's no heavy lifting, so that's the key thing. But there's nothing stopping you doing all the other things, the chair-based and going to all the education classes. There is something for everybody to do. So they've got all of those. So what can our team do here if you're a patient here and you live in the locality here? Slightly different. It's quite an innovative programme, very tailor-made. They're not all quite like this. We do lead walks. We've got gym sessions, so supervised one-to-one. We've got a home programme. And we do encourage patients to come to cardiac rehab because we get that camaraderie of groups, but we know some people don't like that or not able to, so we can offer a home programme. We do lead cycle rides, and then we've got our traditional programme alongside that, but people can break away and do lots of different things, and they can do some swimming as well. And as I say, that's very innovative that we run here in the community. I spoke to my colleagues in Chester as well, which is not that far up the road. They don't see that many patients, but they are again another very innovative and very flexible service. So they tend to take you in, do a full assessment and see what they can do, but they are fabulous and they will offer you something, and they will definitely do something that fits you. It's not a one size programme for this. It isn't for any patient, even if you had a heart attack, but definitely not for yourselves. So what can the other teams? So as I said before, we've been out and we've delivered training across Cheshire and Merseyside for those rehab teams. So you won't be getting turned away there if you live in those localities right across. We did some training in Manchester because we know we've got a lot of patients that come from there, and we did some training there and in Oldham. Obviously we only managed to do a small bit because my colleague left then. But again, we know that there were a lot of the teams that were contacting us to say we're just not sure what to do with these patients, so we just can't see them. The treatment, it does vary in different regions, and hand on heart I will say there are some areas where it's not commissioned. It just isn't, which is a crying shame, and maybe we need to kind of push the research, push the cardiac people who are commissioning cardiac rehab to understand. My colleagues in Chester said they probably have had about 5 in a year, so not a great massive number. Knowsley, our own team here, have not had that many through, so it's certainly, as you said, it's not rare, but it's not common either as well. So we do need to do some work, we do need to push, because it's not fair that a patient who isn't offered, and it can be quite embarrassing when we refer somebody here and we tell you all about what you might be offered, and you get home and then you get a phone call, or you don't get a phone call from your local cardiac rehab, and you say, why can't I go? And it's really demoralising then to say, well, you're not commissioned, or I'm not sure really, we can't take you. And then I have to explain that to a patient, and that's not great. It's awful. Some of the rehabs will say, well, I will take them. Most of the cardiac rehabs that do take patients who've had this surgery do it on goodwill. They're not actually commissioned, so they're not actually paid to do it. That they know the benefit, and they'll find a way, and they'll take you to do your cardiac rehab. But some won't. Some just are not able to break the rules. So there's a big gap, and we know there is a big gap. You've just explained there, Doctor, about those that website, so that you can link into, and the websites are great, aren't they? And you can type in a blog there or ask a question, but there's nothing like the real thing. There's nothing like the face-to-face of actually coming to meet a specialist rather than typing in. Not everybody likes web platforms anyway. This is where you see real people, isn't it? And you get to ask, and you get to see patients who've got fears about life-threatening disorders and medication. So they may not have had the same operation, but they've got all the same feelings as you. So there's a long way to go, and we do, and that's something that is on my radar. But we will continue, and I will continue to make sure that in the rehabs that I look after or have some, I chair, is that we keep up to date, and that we keep doing learning, we keep doing education, and this is something that we will probably do on one of our next education sessions as well, some awareness around this again, because it was a while since we last did it as well. But it's there, cardiac rehab, it needs to be there for everybody, but if you come here you will be referred. That I promise you that. And as I say, I do liaise with some of the other rehabs as well, and we do try to see if we can't get you in somewhere else, or we can't offer you something as well. But you will definitely get referred if you're here as well. Any questions?
Sorry. Just on the first one of the slides you showed about rehab, cardiac rehab, you said you do lead walks,
yeah.
Swimming. We have some patients that can't walk, their paraplegia,
right,
and can't get to the community centres where you say you can come in to see us. Do you do any projects, home visits or anything like that?
Yeah, they do. Well, I know that our team do the home programme.
There are
So yeah,
quite a few that can't get about so much. So.
Yeah. Yeah.
They would be, yeah.
So we do what we, so we're very, very into it really, because we can tailor make it sort of. We've got a lot more on offer. We've got a fabulous, you know, if they can get, somebody can bring them and we can go in the water with them or something like that. We've got that opportunity, but we can do stuff at home as well. We could definitely, yeah, we can here. I say we're very into it, but we've got that luxury, but it doesn't happen everywhere.
It's only worth pursuing.
Yeah, anybody else?
I've got a quick question.
Yeah.
I really picked up on what you were saying about patient fear, but I think what really stood out for me was the fear that you were saying was in the medical community, almost to try and it's turn away because we're frightened of what we might do. We might do more damage. But I thought it was interesting the work that you were showing on the ADAD website. I'm assuming that's based on best practice, experience. Research, and how we can, you know, I'm saying not everybody would like to go online and get web support, but I'm assuming the advice that's up there is pretty proven, and how we can. I mean, this maybe not the Q&A today, but clearly there's an opportunity to share practice.
Absolutely. There's definitely an opportunity when that is live for me to then disseminate that across Cheshire and Merseyside and to all my other colleagues. It's our conference next week, a cardiac rehab conference, the week after next as well. So I do like to talk, so I will mention it while I'm down there. So the more we can share it, we can get that out, and it's a supplement as well, isn't it, of what we can offer. If we can't offer anything, at least we could direct patients to that as well, families to that website, or even take some parts of it and copy it and make it sort of tailor-made and bring it in. So I'll definitely be able to disseminate that information out across Cheshire and Merseyside for sure. Yeah. Well, most rehab sort of have it. They've changed the kind of. They used to be stage 1, 2, 3, and 4, and they've kind of changed that now to stage 0. And commissioning around rehab has gone up now, so they're offering longer sessions now. So there are some people that perhaps after the 6 to 8 weeks do need some more support, and that can often happen in more of a local gym or somewhere else in the community, so they can refer you on to that next stage. There's lots of places that have got that extra support that can carry on and do a little bit more, or just carry on maintenance really. So if you've got an exercise program or something that you can carry it on, so that you're able to then do that at home for continuation. And they offer like reduced sessions to gyms or Tai Chi classes and things like that. So that's another way of finding in once you kind of, because rehab does have a kind of finite point, but we can extend it a little bit for some patients if they still need some more support. Yeah. Anybody else? No, well, good luck. All right, thank you.